Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and my wonderful wife is actually the producer today. She is running the show, so thank you so much, Janet, for doing that. And we are excited to be at the Mises Institute, live in the Mises Institute. I've been following the Mises Institute for quite a few years now. They are a free market think tank, for lack of a better term. I'll let Jeff talk more about that, but we are interviewing Jeff Deist, who is the director of the Mises Institute, and we've interviewed him on our show before. And the Mises is all about free market. So, Jeff, welcome to our show.
Thanks very much. Good to see you again.
Yes. So, tell us a little bit about the Mises Institute.
Well, we try to be an alternative school. We think economics is obviously a big part of everything that happens in life. We wouldn't want to send our kids out in the world not knowing how to read and write, or not able to make change at a cash register, or handle their checking account, or do all kinds of things. And economics is really the study of human action and human cooperation. I think markets are just another word for human cooperation when you more or less leave them alone within the framework of a rule of law. And so we really exist to try to fight against a couple of things. First of all, is widespread or mass just economic ignorance, just a lack of economic knowledge or understanding. I certainly didn't get any economics in high school. I didn't get into undergraduate, for example. But beyond that, ignorance also within economics itself, we think that the profession has gone down a very bad path. It's become a mathematical and statistical modeling exercise. As a matter of fact, to get a PhD in economics today, you need to take very difficult high-level math, vector calculus and such.
Really?
And so this is what students are studying, as opposed to studying logic and understanding human action, and really viewing economics almost as a branch of philosophy, which is how we would view it. And so the Austrian school, which we promote and support, has a different view than what we might call today's mainstream. And so in our opinion, economists today aren't doing a lot to help people understand the world, to help us make us happier or healthier or wealthier, which we think social sciences ought to do. But worse than that, they're actually doing some harm. They're doing some active harm by promoting or teaching in university settings misinformation, by trying to have these statistical and mathematical models and tell us, oh, there's no problem with the housing market. That's Ben Bernanke in 2005, 2006.
Right.
And of course, he was disastrously wrong. And so we really want to be there as an alternative school for lay people to understand economics in a way that they can and that makes sense to them, to improve their lives and their understanding, but also to serve as an alternative to what we think is the economics mainstream, which has gone down a bad path, Shawn.
Yeah, absolutely. Well, that was a great explanation. Thank you. And how does this apply to healthcare? I can tell you that one of the things that I was thinking about when you were giving your introduction is you said logic. They don't teach logic anymore. Well, that sounds like healthcare. It sounds like pharmacy and medicine. We teach a lot of black and white stuff, and we're not letting pharmacists, doctors, and nurses make rational, logical decisions anymore. We're just being told what to do based on certain models. And I think the most important thing that sets us apart as humans in pretty much any whether it be economics or whether it be healthcare, is that we have logic and rationale for a reason. And I think that our healthcare would be better off like that. So with that in mind, and the Mises principles of economics, how does that apply to healthcare? Does that apply to free market principles in healthcare?
Well, it applies in spades. I'll just start with that. What we have to understand is, when you introduce a third party, whether that's the government itself or whether that's essentially a government sanctioned or even mandated insurance company, right, a third party payer, then you've damaged the natural relationship between a physician and his or her patient, between a pharmacist and his or her patient, and you've introduced a middleman who is making decisions on a process rather than results-oriented platform, right? Well, a patient evidences these symptoms. Okay, your HMO employer tells the doctor, you check these boxes, prescribe this drug.
Right.
Okay, you're taking the art and you're taking the experience, and you're taking the instincts away from the practitioner who is part technician but also part artist, right? There's an art to that. And so the introduction of a third party is disastrous to that relationship, not only in terms of the care that the patient receives, but also in terms of the ratcheting up of the cost. I met you and Janet through Keith Smith, a dear friend of mine who runs the Free Market Medical Association. I've been to some of their conferences. And we all know that if medicine were run on a cash basis, where you paid cash for basic services, you paid cash for basic prescriptions, and insurance existed purely to account for, with using actuarial risk and pricing according, sorry folks, to your variables, maybe your age, maybe your weight, maybe your smoking habits, you're a daredevil skydiver or something, you're going to pay a little more. Having insurance for truly catastrophic, life-changing, a cancer diagnosis, a serious illness, a serious hospitalization, a serious car accident, something like that. That is the point of insurance, something where you can assess premiums based on risk using actuarial reality. That's what insurance is for. Insurance is not for your day-to-day sniffles and visits to the doctor or the urgent care. As a matter of fact, because of insurance, we've created two classes of people, those with and without. And those without are often clogging up ERs for things that could be handled by a primary care physician, that could be handled by an urgent care center. So the gross distortions introduced, not only in the quality of care, but also in how we pay for things by having third parties, has turned what was the greatest, most envied healthcare system in the world, in the free world, really up until, let's say, the 1950s or 1960s in America, and turned it into an absolute laughingstock where people with so-called single payer, like in Canada and the UK, will laugh at us.
Yeah, exactly. So you're telling me that when the government doesn't have to be involved in healthcare, and when they do, things get more expensive and the quality goes down. Is that what you're saying? Give some examples.
Well, let me just go back to the example of the first half of the 20th century in this country. What was the model then? The model was cash for basic services. Okay. And all doctors, I worked for Dr. Ron Paul. He did this in the 60s. All doctors understood that a certain percentage of your patients couldn't pay. You would see them for free. You might see them in exchange for some services, like back in the day, they'd give you some chickens or something, or you would simply write off their bill. And doctors were not considered particularly noble for this. It wasn't considered any great sacrifice. It was just part of life as a doctor. Cash
and just on that same point, sorry to interrupt, but on the same point, they didn't brag about how much charity care they gave away.
They didn't brag
about it. They just did it.
No, in 1968, when Dr. Paul opened his OB practice in South Texas, weren't a lot of OBs around. It was a rural area. Women had to travel a long ways. Some of them just couldn't pay. And that's the way it was. And he treated them all the way through delivery. And that's how it was. Okay. So to get back to that sort of thing, and there's pressure towards that direction. I mean, we have these minute clinics. We have Walmart getting into optometry and dentistry and basics, and then you have on the other end, very wealthy people can have concierge doctors. If you're Barbara Streisand, you don't call your dermatologist and say, oh, we can see you in 3 months, right? Barbara Streisand is rich. She has a concierge doctor. He or she comes over and sees Barbara Streisand that day. Okay, so you'd have really rich people paying cash for basic services in a luxurious way, and you'd have really low, poor people or less affluent people paying cash for basic services at places like Walmart. And then you would have a charitable network, including charitable hospitals, which were unbelievably robust in this country in the first half of the 20th century. Catholic hospitals, for example. You would have very robust charitable medicine, but because the prices have all gotten so screwed up and so ratcheted up by this insurance nightmare, we've just lost sight of a cash medical system.
Well, when you look at the history, the Catholic hospitals, for instance, they were charity, and they truly were. And then the problem with them now is most of those hospitals, 80% of their funding sources, their payment sources, comes from government sources now. So they're not charity anymore. They're basically taking tax dollars and using them, for big profits. And a lot of them are nonprofit. And really, we really should, rephrase that they're not nonprofit. They're tax exempt. and really they're not, the charity that they give away now, instead of being like it was with Dr. Paul in the 1960s, is more, well, we're going to charge you tenfold for what for the services of what they really cost, and then we're only going to collect 10% of that, and then we're going to write the rest off and call that charity. And that's what's happened to a lot of those hospitals, and it's very unfortunate. We really have to look into that. Now, it would have never happened in a free market system if somebody else, like a third party, especially the government, wasn't paying the bill, because they would have had to look directly into the eyes of consumers and charge them a reasonable price and get a quality service for that.
Well, one of the great catastrophes, of course, of Obamacare is the elimination of truly bare bones, high deductible, catastrophic policies. In my own life, when I got out of college, I was in my 20s. I thought I was bulletproof, of course, living life. My dad was not so convinced that I was bulletproof. And he was able to buy, again, I'm in my 20s, my health profile, the risk is low.
Yeah, right.
He was able to buy a high deductible, something like $10,000 deductible, which in my 20s I could never. Right. But he would have, I suppose. A high deductible catastrophic type policy that would have only kicked in if something really bad happened to be, like, again, a car accident or something. And the premium on that was something like $175 a year. A year, because of just the risk. Right. And so we've lost the ability to have those kinds of policies. The marketplace, not only in the cost side and the actual provision of nuts and bolts services like cleaning your teeth, but on the insurance side, also with reinsurance and packaging things, you would see unbelievably novel approaches to making healthcare more affordable if the market were allowed to work. But like so many other things, medicine and the industries around it, particularly insurance, health insurance, so-called, have become so heavily regulated that we really can't call them part of the free market. And so some of these big health providers, they're almost quasi-governmental entities. So it's not like the NHS in the UK. You're not going directly to an NHS doctor and with your waiting list or whatever. But you're going to a doctor who is essentially paid according to a schedule set by government, especially when it comes to older citizens in the Medicare arena. And the whole thing is just absolutely stifling. And what makes me angry and sad is that we end up sort of with the worst of both worlds. In other words, I would consider Canadian and English medicine true single payer. The government is the provider. The doctors work for the government as a direct employee. I would consider that the worst of all worlds. But from the taxpayer's perspective, yeah, it's free. It might be crappy. You might have to wait. But here we get sort of the worst of the price increases because of government intervention. But we also, don't get the beauty of a cash system. We have to look at the bright spots. There are heroic doctors out there working against us. There are pharmacists like yourself who are bucking the tide. There are DPC, direct primary care physicians, bucking the tide. And many of them now, and there's one in my town of Auburn, Alabama, a college town of about 75,000. There are a couple here now who charge a pretty low annual fee and for same-day visits, et cetera. Cracks in the system are showing, and entrepreneurs are filling them. Anything from medical tourism to cash clinics like Dr. Smith Surgery Center in Oklahoma City. And there's an example where, you go get surgery at your local hospital. You've got so many bills. You've got the hospital bill. You've got the anesthesiologist bill. You've got the surgeon's bill. You've got the drugs bill. You've got the aftercare bill. And all of those, the co-pays and the deductibles are rising. And the cash prices offered by clinics like Dr. Keith Smith's is falling. So that delta between the two is reduced to the point where, if I had to go get a knee replacement or something, I think I would just go to Dr. Smith's clinic and pay cash.
There's no doubt in my mind, my wife and I talk about it often, is that if it's an elective type surgery, that's where we're going. I mean, a good example is my youngest son, about 3 years ago, he compound fractured his tibia, typical 18-year-old boy doing some 18-year-old boy stuff. And he came up short on a jump when he's jumping on an irrigation canal, broke his tibia. And of course, I'm out of town and Janet's talking to me, and I'm thinking, I don't want to go to my local hospital. I'm thinking, Janet, how do we get him to Oklahoma? She's like, Shawn, his bone is sticking out of his leg. We can't do that.
Sure.
So we had to go through the whole process. And I was in contact with Keith Smith while I was bargaining with the hospital, negotiating down a bill, which they weren't very good about. And like you said, there were 5 or 6 different bills: radiology, hospital bill, doctor's bill, pathology, or labs, all separate. Anyway, they all added up to $48,000.
Wow.
Right. He was there. It was an outpatient deal. He didn't stay overnight or anything. Healthy kid. I asked Dr. Smith, how much would it be at Surgery Center of Oklahoma? And true to form, it's usually about 8 to 10 to 1. And at Surgery Center of Oklahoma, it would have been $8,000. Now, when you talk about co-pays, people say, well, yeah, but if you had insurance, it would be better to do this. And I guess in our situation, we didn't have a lot of choice to go anywhere else because of because of the situation. We had to get it done right away. It wasn't elective. But I use it as an example because the pricing structure is still there. And let's say we did have insurance. And we don't have typical insurance. I don't believe in traditional insurance. I believe, like you said, with regulation, traditional insurance is government insurance. It's so highly regulated after Obamacare that if you're on traditional Blue Cross, United, it's government insurance. And so we have a health sharing ministry. We, talk about your dad having $175 a year policy for you. We pay $170 a month for ourselves. And it's incredible. Anyway, if you think of the copays that a person would have had to pay, a lot of people will pay a 20% copay. 20% on $48,000 is $8,000, $9,000. So you'd be cheaper, better off to go to Surgery Center of Oklahoma. Now, here's another thing.
Folks, if you get in a car wreck and break your leg, do it in Oklahoma City.
Yeah, right. Now, here's another thing, and hospitals want to argue this, and I've had great discussions with Dr. Smith about this, is they want to argue, well, if it's cheap, then the quality's not as good. So we know that's not true. Tell us why that's not true.
Well, because your provider's incentives are the same as yours, right? That's what's key in any market transactions. You want a win-win situation. And if if you go into your doctor and he or she is overworked and grumpy and angry about the Medicare reimbursement they're getting for your cataract, let's say, and you're just another number in the system. And if you weren't there, some other elderly person with a cataract would be there in your stead. And they're limited to how much they can get reimbursed. Well, then you don't have the same sort of win-win relationship. But if I go to Dr. Keith Smith's clinics, I mean, they want the surgery to go well. They want my check not to bounce. Right. They want the doctors to get paid a reasonable amount, oftentimes more than they might get paid by their local hospital system or Medicare reimbursement, which is very interesting. And they want everybody to go away feeling good about it. And perhaps the patient is out there singing the praises of their surgery center to other people he or she knows. I've certainly sung Dr. Smith and his partner's praises to a lot of people who have actually gone there as a result of knowing about it through their relationship with me. So it's a very simple market transaction. You don't hate your customers' guts, right? And you share in their outcome. So this seems simple, but there's this bizarre idea that what are we talking about here? What's the politics? What's the reality on the ground? There's been this bizarre thinking inculcated in several generations of Americans now that healthcare is different, right? It's somehow different from other goods or services on the marketplace. It's unique in its provision. The market doesn't work. And number two is that you're entitled to it as a matter of being born onto God's earth. Well, by definition, you can't be entitled to the efforts or labor of another human. Right. That's not how morality works, for one. So think of all the people and sweat and toil that went into having a surgeon bring you a particular set of skills, and the development of the drugs that were used to anesthetize you or to heal your infection afterwards, whatever. I mean, these are marvels. And the idea that you have a right to those things, which represent the sweat and toil of countless people in a market, is just, I don't know how to reconcile that. I disagree. And I've gone round and round with a lot of people who think that you do have a right to health care. So because we have this moronic idea that the market doesn't work somehow when it comes to medicine, and that you have a right to medicine for free, those are pretty hard, big hurdles to overcome in terms of persuasion, political activism, whatever, lobbying, whatever it might be. So I think that the better approach, the more guerrilla approach, where you use your time and energy and resources wisely, is to go out and just do things like DPC doctors are doing, like cash clinics are doing, like medical tourism is doing, like renegade pharmacies are doing. That's how we have to go after this thing, using the market and using entrepreneurship to fill in the cracks, which the government system still leaves.
Yeah, and I think I'm optimistic. There's been a resurgence or a restart maybe, because let's face it, like you're talking about with Dr. Ron Paul, 50 years ago, this is how medicine worked. And it was basically 1964 when Medicare came out. That's what really, really messed things up. And then, the government got involved highly into, medicine with Medicare and Medicaid. And of course, if you look at what happened right after that, the cost just went, and utilization went up because, there were certain procedures that were paid at a high rate. And so all of a sudden, people needed more of those procedures. I mean, a good example is nursing homes were basically non-existent in the United States. Not non-existent, but their growth over a 10-year period after Medicare was 700%. Not a surprise. Medicare and Medicaid pays for nursing homes. So all of a sudden, everyone needs a nursing home. And instead of the family taking care of their elderly parents or their sick family anymore, we wash our hands of it and let the government do it, kind of like what we've done with government schools. And the care is never going to be as good. It's just not. I mean, there are three things that we can get when we buy something, and that's basically price, quality, and service. And usually, in a free market, we'll tell people, well, you can get two of the three. But in healthcare, if you pay cash for services, you get all three, because the government system is that bad.
Well, when it comes to entrepreneurship, we all have responsibility as individuals to be as healthy as we can, to try not to consume all these healthcare resources, and especially given that the percentage of the population over 65 is set to double between now and 2050 in this country. So a lot of, it's going to be an aging, graying population. I consider myself in that group, and so we have to not only avail ourselves of the market, but we also have to take responsibility, I think, for our own health, and try not to need too much healthcare. Because, as you said, the market exploded when you made it free. All of a sudden, people find all kinds of reasons to go to the doctor. I think we're probably over-doctored in this country. In other words, there's probably too many doctors treating trifling things and maybe too few doing the really important work.
I agree with you 100%. And, it's basically economics. It comes down to economics. When, a diabetic patient, for instance, Medicare will pay for them to get a med check every month. I'm just using an example. I don't know if that's exactly true, but, well, if that's the case, whether they need to be seen or not, those clinics that take government money, they're good at saying, well, you need to come in next month and next month and next month. And, but when you look at the overall health of our society, it's not working. We're not keeping people healthy. That's for sure. I mean, obesity is a real pandemic in this country. And, look at type 2 diabetes, for instance. Type 2 diabetes is definitely epidemic. And I always wonder, and I want your thoughts on this, if all the fancy drugs that we have and all the fancy medicine that we have to treat diabetes, if those weren't there, and people had to change their lifestyle, because type 2 diabetes is a lifestyle disease, period. Janet and I are two pharmacists that do not believe in drugs to treat type 2 diabetes. You can definitely reverse that with your diet and your lifestyle. So I wonder if people could do that, if all that fancy medicine wasn't there, if we would have less of a problem. But because it's free, imagine if people had to pay $1,000 a month for the medication. Would they change their diet if they had to pay for it? What are your thoughts on that?
Well, it's all about incentives, right? I mean, incentives are real, and it seems to us that most of modern economics is acting like incentives don't matter. Right? Well, you need to raise minimum wage. Okay, well, let's look at that. Let's make prescription drugs free. Medicare Part D passed in a very unholy late night vote.
Yep.
In the House of Representatives, where a bunch of members who were on the bubble voting no had their arms twisted by the House Majority Leader at the time, a guy named Tom DeLay from Texas, went around and threatened several members, one of whom was about to retire and was hoping his son would take the congressional seat. This member was told, your son will never be a congressman if you vote no on this bill. Now, that's just one example. This is about 3 a.m., by the way. So this Medicare Part D free drugs bill, in an actuarial sense, costs far more than just the original Medicare. In other words, drugs cost more than doctor visits.
Yeah.
So if we go back all the way to LBJ and say, what is Medicare going to cost actuarial over many decades? It turns out the Part D drug benefit actually costs more. And that was passed by the George W. Bush administration, okay, with definitely a Republican House, and I believe still a Republican Senate in the early 2000s at the time, obviously a Republican president. And this was basically to help George W. Bush get senior votes against John Kerry in the 2004 election. Okay, so the idea that all of this stuff happens because bureaucrats think it out and do public policy analyses and all that is just not the case. This is all political, and as a result, ever since then, huge pharmaceutical companies have had a whole new group of patients and potential payments who can get their drugs for free.
Yep. And Janet and I, we practiced before Medicare Part D. So when we first got out of college in the 90s, there was no Medicare Part D. So guess what? Pharmacies and drug companies, they had to keep their prices low and competitive because 50% of your population, or plus 50% of your population, were paying cash. So you had to know prices. You had to, Walmart. I worked for Walmart out of school. We had a pricing structure, and we had to be very competitive with the pharmacies around us. Mm-hmm. Now, those days are gone. Call your local pharmacy and say, hey, what's the price of XYZ drug? Well, what insurance do you have? Well, I don't have insurance. Well, we don't know. We bill your insurance. They tell us well, I don't have insurance. What's the cash price? I don't know. Crazy. And the price after Medicare Part D is a great example. And I talk about it in my book. After Medicare Part D, the price of prescription drugs went up 19% in 1 year.
Wow. Of
course they did. Now these aren't exact numbers, but the average price of a month of a prescription back in the 90s before Medicare Part D was like $50 a month. Now the average price is like $500. I am not kidding. It is something that high. We shouldn't be surprised. So what happened then is what they did is the government made it expensive because of their rule, because of Medicare Part D, and then everybody else, even if they don't have that government insurance, they have to pay too. That's the unfortunate part. Now, the good news is there are still free market examples out there, whether it be pharmacy, whether it be doctors, where you can find good quality healthcare at a very reasonable price. We've talked about some of them. And that's what our goal is to educate people, educate and empower people to take charge of their own health, for one. And the best health insurance that we have is not some kind of policy that we can buy. It's how we take care of ourselves. That's first and foremost. And then another important part of that too is to take care of your own health financially. So make sure that you shop for healthcare, whether it be doctor, whether it be pharmacy. And even if you do have insurance, still shop, right? What are your comments on that?
Well, I think it's true, but you can still shop, you can still negotiate, and I love the idea of moving towards a shared health program like you're a member of. I have several friends who are involved in some of those. Some of them are Christian based, some of them are not.
Mm-hmm.
A cost sharing thing. But again, we got to get everyone aligned. We have to start to align interests. And any kind of cost sharing, it by definition puts you all on the same page with the same incentives.
Right, exactly. So Jeff, as we wind this podcast up, what do you have a passion for?
Well, I certainly think that medicine is probably amongst the most interesting industries in that it's moribund. It's been corrupted horribly by government. So the opportunities for entrepreneurship are exceedingly ripe. So it's not like certain industries that are more open, and so there's already a lot of competition in them. So I think that a healthier America is something that we should all play a role in. We should all be interested in. We should all be concerned about our grandparents, our grandchildren, whatever it might be. So we got to get government out of medicine. We have to separate the two if we're ever going to move forward in this country without addled old people taking 10 prescriptions, hugely diabetic population, young people who are consuming too much screen time and too much sugar and already horribly out of shape. I mean, we got a problem in this country, and we address it through incentives, I believe.
Awesome. I think you're right. I agree with you 100%. So as we wrap it up, what's the best way to get a hold of you if anybody has any questions about the Mises Institute or has any questions for you?
Well, just come to Mises.org, MISES.org, and you can always find my email there or follow me on Twitter at Jeff Deist, all one word.
Awesome. I love it, Jeff. Thank you so much.
Thanks, Shawn.
I appreciate your time.
Okay, you bet.
And thank you for listening to Health Solutions with Shawn and Janet Needham. Tune in. Let's see what it'll be Monday. We have a nurse practitioner on, and she's going to be talking about women's health and how to empower women to take charge of their own health, which is basically the underlying theme of our podcast. So thank you, listeners and viewers, for tuning in to Health Solutions with Shawn and Janet Needham.